Hello everybody, welcome to another Thirsty Thursday. No, Thirsty for Knowledge Thursday. Sorry guys. So today, this is Harry Koster. Today we're going to talk about shoulder instability. So kind of following up on Earl's, exercises for shoulder instability yesterday, want to explain a little bit of what is shoulder instability. So this is a shoulder, this will be a right shoulder. So here's your collarbone, here's your shoulder blade, and here's your upper arm bone. Now, earlier we have talked about impingement, but this is a little bit of a different issue. Shoulder instability happens essentially when the head of the arm comes out of the socket in some way or form. So, it's typically a subluxation or dislocation of the head of the humerus, that's this piece of bone here, out of the socket. So most of the time this will happen with an injury, at least if it's traumatic, it will come with an injury that typically involves this kind of movement. So this could be some sort of overstretching of some sort. I've actually dislocated my shoulder many years ago playing basketball, and it was this kind of movement, intercepting a long ball, and yes, my shoulder came out of the socket. So naturally, the shoulder has a lot of mobility because a shoulder can move all the way up, all the way back, all the way up, all the way across, and on top of that we have movement into rotation. So there's a ton of movement in the shoulder, and the downside effect of that is that there's a lot of mobility. So you have muscles and tendons and a capsule that holds the shoulder in place, but sometimes that will get overstretched. So like I said, with this kind of injury, that can definitely happen. It can also happen just over time that things kind of loosen up because of repetitive movement. So we see this a lot in pitchers in baseball because of that excessive movement that you're doing. Over time, everything gets stretched out. Also, some people are actually just born super flexible. And it sounds like that'd be a great thing, but it isn't always a great thing. So what happens, you get to the point where the shoulder feels unstable. There's some testing that we can do for that. So let's have you lay down, Adrian. So since the movement that we're doing typically is this type of movement where the shoulder will come out forward, that's the most common one. The testing would be in this position. I'm going to see if he's unhappy being here. So it's called an apprehension test. And if he really doesn't like going there, that could be a sign that there's some shoulder instability. And then another test, we're actually going to go back here. Okay, and I'm going to apply some pressure and see if that changes his symptoms at all or not. Those are already signs of instability, and then I can just in general start moving the shoulder around, and if his shoulder just easily comes forward, I mean this is pretty normal, I get a good hard end feel, but if it comes out really easily, then again we're possibly looking at shoulder instability. You can go ahead and get out. So when we're looking at somebody with shoulder instability, so what's the recipe for this? Yes, ultimately there could be some surgery that's needed to tighten up some of the ligaments or tendons, or capsule, whatever the problem is. Or sometimes it's a repair of the labrum, which is on the inside of the shoulder, a little rim that makes that cup a little bit deeper. But ultimately we'd like to prevent that. So the first thing that you need to do is really do physical therapy, reduce pain, restore range of motion, and go into strengthening exercises. And some of those Earl showed yesterday, and that's really what you got to do. So my shoulder dislocated about 10 times several decades ago. I never had surgery, and I just made sure that I kept my shoulder nice and strong so I can move it around without any problems. And it stays nice and strong. And that's what you really need to learn, because those ligaments don't really, go back to being short again. I mean, once they're outstretched, it's kind of like an elastic band. Once you stretch it out, it stays stretched out. So you just have to make sure that the muscles are nice and strong and protect your shoulder joint. So, definitely, if needed, do some of Earl's exercises. But if you have any questions about this, come see us, and we'll definitely educate you on what to do, what the best course of action is.